Mama, I'm John Mike Perez, and I'm here to perform essential intrapartum newborn care. So, we need to know this, especially in our nurse, to decrease or it may decrease the mortality rate of the newborns. Now, first we need to provide privacy to the client. And now, we're going to gather all of our equipment, which is 3 surgical gloves, 1 bonnet, 2 warm blanket, erythromycin, oxytocin, hepatitis B shot, and vitamin K. And we don't have any plastic clamp, but imagine this as plastic clamp. And I don't have any surgical clamp, so this will be provide as my surgical clamp, and surgical scissor. And next is, now what I'm going to do is perform hand hygiene thoroughly to avoid cross-contamination. And now I'm going to put 2 pair of gloves. To deliver the baby, state the time of deliberation of the baby and the sex of the baby. Okay, 7:05 male. And now we're going to dry the baby using the first blanket. Dry the baby at least 30 seconds and rapidly assess the breathing of the baby. Dry the baby from head to toe and other extremities. It will stimulate the breathing of the baby. Do not wipe or remove the vernix of the baby because it will be a natural defense of the baby. Wipe at least 30 seconds. Okay. And now, remove the wet blanket and put it in the wet section. Now, we're going to place the baby in prone position to the mother's abdomen or between the breast of the mother to provide skin-to-skin contact with the mother. And now, place it in prone position. Place the baby in prone position. And now, after that, we're going to place a bonnet in the head of the baby to provide warmth to the baby. Our bonnet is too big, sorry. And now, we're going to place the second blanket to the back of the baby to give warmth again to the baby. And now, remove our first glove. And place it on the container. And now, we're going to wait 1 to 3 minutes before cutting the cord because it will prevent anemia for the baby. And now, assume that 1 to 3 minutes is done. And now, we're going to check for the pulsation in the clamp of the baby. So, if we see the clamp, if we see the pulsation has stopped, we're now ready to clamp the umbilical cord of the baby. Now, first, we're going to use the plastic clamp. Clamp it 2 cm away from the base of the umbilicus. And now, the surgical clamp, clamp it in the 5 cm away from the umbilicus. And now, we're going to cut the cord of the baby near the plastic clamp. And place it on the cling container. And after that, we're going to give oxytocin to the mother to prevent uterine atony. Now, imagine that there is a oxytocin here. Now, we're going to administer oxytocin to the mother. Okay? Okay. So place it in the sharp container. Imagine this as a sharp container. So now we're going to deliver the placenta of the mother. Imagine that I have a placenta here. Place it in a container. And check for the bleeding of the mother. Okay, check the perineum of the mother too. Now check the condition of the mother and the baby. Wait for 30 minutes, 30 minutes to 1 hour, and we will see sign of the baby that he is ready for the first breeding, for the first best feeding. Now, after 30 minutes, after the first breastfeeding of the baby, now we're going to ready to administer the ointment, hepatitis B, and the vitamin K for the baby. Now, we're going to remove, remove it here. Now, we're going to put the ointment to the eye of the baby. Okay, imagine that I have put it and place it on the medicine tray. And now, we're going to inject for the hepatitis B shot or the vaccine shot to the vastus lateralis of the baby or the thigh part of the baby. Okay? That. Okay. Inject. Hold. Inject. And after that, place it on the shot container. And next, we're going to administer the vitamin K shot. Now, again, in the vastus lateralis. Okay. Place it on the shot container. And maintain the skin-to-skin contact of the baby. And after that, now we're going to check for the mother's condition. Okay, okay, ma'am. And after now, remember that bathing is allowed after 6 hours to prevent hypothermia to the baby. And now, remove your gloves. Okay, place it on the container. And now, perform hand hygiene again and other infection control. And now, document all the data in the procedure. And now, that's all, ma'am. Thank you po.